Hi, I'm Debbie Morrow Bender. I am a nurse anesthetist. I have a doctorate degree in nurse anesthesia practice. I have a specialty in pain management, which means I'm doing epidural steroid injections, trigger point injections, and injections for headaches. Doing injections every day. I am certified in Botox and Filler. Because of my pain management background, I take great pride in providing injections with the least amount of pain possible. I take special steps that many others don't to make sure that it's just minor discomfort doing Botox and fillers. So I'm going to talk about Botox first, and we'll talk a little bit about fillers. Botox has been around since 1989, and it will soften the lines in your face and the wrinkles. And how it works is a tiny needle is injected into the muscle, and it takes about 2 to 7 days to work, and it will last up to 6 months. Some of the common side effects are headache, temporary eyelid swelling if you're getting the crow's feet done. I've never seen it, but it is in the literature that can happen. Temporary eyelid or eyebrow droop, but most time done right, you're going to get a nice eyebrow arch with Botox. You can get some temporary bruising, especially if you're on ibuprofen or aspirin. And then anytime you're introduced anything through the skin, there's always a risk of infection. Botox is very predictable. Everybody's body reacts differently. Some people have stronger muscles than others, which is why one person may need a little bit more Botox in one area than the other. So some typical areas and the units that are typically used in the area, this is called the glabella, and you'll get vertical lines this way. And to get rid of that takes about 20 units of Botox. Then you'll have horizontal lines on your forehead, and to get rid of those, it's about 12 to 14. Crow's feet take about 12 to 20 units, and there's a area called nasalis is right here. They're called bunny lines. So when you squint your nose up, you laugh, you'll see lines here. And we can do 2 to 4 units on either side and get rid of those. I'll send a list of how much Botox is per unit because it depends on how many people are at the party. Okay, let's talk about fillers a little bit. I didn't know much about fillers before I started injecting them, and I really like them. So a couple of places that I really like to do are the lips. So as years go by, you start losing volume in your lips, in your cheeks, and in your face. And you can tell the volume is being lost because you'll get little vertical lines on your top lip. I'm going to show you my before and after lips. Upside down. All right, so this is the before, of course, and the after. And you can see that I have asymmetrical lips. I have less volume on this side. And afterwards, you can see that my bottom lip is more plump and my top lip is more even now. Another place I really like to do fillers is in the cheek, because not only is it going to give you nice high cheekbones, many people have a deep nasal labial fold or laugh lines right here. And when you do cheeks, it kind of brings the skin back and smooths out those nasal labial folds. So some of the common side effects of fillers are redness, swelling, lumps, and bumps. These are all kind of minor reactions. There are a few very rare reactions I'm going to tell you about. I've never seen them, and most injectionists will never see them in their whole career. But fillers can occlude a blood vessel, and you can get blistering and scabbing and scarring. I'm trained to watch for those signs of vessel occlusion. I have a medication to inject to get rid of that right away. And one last, even rarer, risk, and this is how rare it is. In 30 years of people injecting fillers throughout the whole world, probably hundreds of thousands of injections, there has been a handful of blindness. And what happens if the filler breaks off into the blood vessel, travels to the blood supply to the eye, and can cause temporary or permanent, mostly temporary, blindness. And again, I tell you, this is so rare. I people just don't see it, but because it's in the literature, I'm going to let you know. So I'm looking forward to meeting everybody, and if you have any questions, I will answer them when I get to meet you. Thank you.